Hello and welcome to this video podcast from Vetstoria. This video has been prepared with the help of our resident vet Julian Poublon from the Lady Dane Veterinary Centre. Our patient is an 8-year-old German Shepherd dog called Dexter. He's affected with CDRM, which means chronic degenerative radiculomyelopathy. This condition is predominantly seen in German Shepherd dogs, although other large breed dogs may be affected. Patients are usually 6 years or older, and males may become more commonly affected. In this condition, the dog loses awareness of the position of his hind legs and feet. Initially, affected animals knuckle and scuff on their hind toes, which often result in sores on the feet. They have an unusual gait and typically have difficulty climbing up and down the stairs. Swaying of the hindquarters also occurs when the animal is turning. Within several months, muscle wastage develops over the trunk and hindquarters. A degree of fecal and urinary incontinence may develop late in the disease. Eventually, the patient cannot rise without assistance and would pull himself along with his front legs. It is important to note that pain or discomfort does not seem to be a feature of the disease. It is not possible to diagnose CDRM definitively. Usually, your vet will make a diagnosis based on the typical history and symptoms. Ideally, other potential causes of hind limb gait abnormalities should be ruled out. Those include disc disease, tumours affecting the spine, hip dysplasia, where there is a problem with the formation of the hip joints, and cordia equina syndrome, where there is a pressure on the end of the spinal cord. First, it is important to understand that CDRM is a non-treatable disease. However, this is a slowly progressing condition and affected dogs may live a pretty normal life for several months or years if monitored properly. The most important thing is to maintain regular exercise and optimal body weight in our patients. For that matter, it may be necessary to support the patient's back end while exercising. Then, your vet may prescribe some medications, such as vitamin E, vitamin B, and a drug called epsilon aminocaproic acid. The dose for epsilon aminocaproic acid is 500 milligrams 3 times a day. It is believed that it slows the progression of the disease in about 50% of patients. An 8-week duration treatment trial followed by a neurological assessment by a vet will help evaluate the efficiency of the treatment in each individual dog. When it helps, the treatment should be continued lifelong. When it doesn't, then it may be discontinued. Within several months, unfortunately, CDRM usually leads to euthanasia of the patient. It sadly did for Dexter, who passed away during the summer of 2007.